السلام عليكم ورحمة الله. مرحبا بكم مجددا في محاضرة جديدة من سلسلة محاضراتنا عن مراجعة أسئلة اختبارات البرومترك Review of Prometric Test Question. This is lecture number 5 in Infection Control and number 8 in Ghaith Review. Today we are going to discuss 5 questions from question number 64 up to question number 68. معكم محمد الثمانية. هي نبدأ مباشرة. Question number 64. A patient presented with high fever, headache, vomiting and neck stiffness for the past 3 days. Which of the following is the first diagnostic intervention for this patient? The options are number A, urine and stool analysis, number B, lumbar puncture with CSF aspiration, number C, complete blood count, number D, chest and abdominal x-ray. وقف الفيديو هنا اختار الخيار بشوف سهل. The correct option is option number B, lumbar puncture with CSF aspiration. ليه اخترنا الخيار رقم B؟ نشوف rational. Fever, headache and neck stiffness are common clinical manifestation of meningitis. A lumbar puncture or examination of the cerebrospinal fluid CSF is the cornerstone of the diagnosis. So the correct option is option number B, which is lumbar puncture with CSF aspiration. Question number 65. When a patient is admitted with acute influenza, what type of isolation is most appropriate? The options are number A, reverse isolation, number B, contact isolation, number C, strict isolation, number D, respiratory isolation. وقف الفيديو هنا واختار الخيار بشوسة. The correct option is option number D, which is respiratory isolation. ليه اخترنا الخيار رقم D؟ نشوف rational. Influenza virus is spread from person to person through large particle respiratory droplet transmission. When an infected person coughs or sneezes near a susceptible person. Therefore, the most appropriate type of isolation is respiratory isolation. So the correct option is option number D, respiratory isolation. Reverse isolation is a way to prevent a patient in a compromised health situation from being contaminated by other people or objects. Contact isolation for diseases that can be spread through contact, and strict isolation for disease spread through the air and in some cases by contact. Question number 66. What precautions are necessary when caring for a patient with hepatitis A? The options are gowning before entering the room. This is number A. Number B, wearing gloves for direct care. Number C, wearing a mask at all times. Number D, placing the patient in a private room. وقف الفيديو هنا واختار الخيار بشوسة. The correct option is option number B. ليه اخترنا الخيار رقم B؟ نشوف rational. The transmission of hepatitis A is mainly fecal-oral. Enteric precaution or blood and body fluid precaution is the infection control measure for hepatitis A. It includes the wearing of latex gloves when handling feces, urine, saliva, and blood. Hand washing is essential. So the correct option is option number B, which is wearing gloves for direct care. Question number 67. The nurse is assigned to care for patient with Ebola virus disease. Which of the following is the Most common mode of transmission for Ebola virus. The options are number A, vector, number B, airborne, number C, direct contact, number D, common vehicle. وجه البديهين واختار الخيار بشوسه. The correct option is option number C, direct contact. اللي اخترنا الخيار رقم C نشوف راشد. Ebola virus disease EVD, previously known as Ebola hemorrhagic fever, is a rare and deadly disease. The virus spreads through direct contact with the blood, secretion, or bodily fluids of infected people, and with surfaces and materials contaminated with these fluids. So the correct option is option number C, which is direct contact. Question number 68. A nurse is carrying a patient diagnosed with pulmonary tuberculosis, and she has to wear N95 mask when she enters the patient room. Based on the cycle of infection, which of the following is the reason to use the mask? The options are number A, break the transmission chain at the portal of entry. Number B, break the transmission chain at the portal of exit. Number C, kill the agent exits in the patient's room. Number D, eliminate the reservoir of the bacteria. وقبل بيجي هنا واختار الخيار الشوسي. The correct option is option number A. Break the transmission chain at the portal of entry. ليه اخترنا الخيار رقم A نشوف راشد. Tuberculosis is an airborne disease. It occurs when tiny droplets exit the respiratory tract of a person and remain suspended in the air and are inhaled by another person. The portal of entry for TB is nose. Wearing N95 mask break the chain of transmission at the portal of entry. Therefore, the reason to use N95 mask when carrying a patient with pulmonary tuberculosis is to break the transmission chain at the portal of entry, which is the correct option. شكرا جزيلا. نتقابل في محاضرة جاية. Don't forget to support us by comment, like or subscribe.